A quiet ache in the shoulder, a dull pain in the lower back, maybe a persistent soreness in the jaw or neck. At first, these aches seem harmless, just part of getting older. But what if they are not? What if your body is whispering a message that should not be ignored? In today's video, we are going to talk about 5 subtle body aches that often show up after age 65 and what they could really mean. These are not the dramatic pains that send you rushing to the hospital. These are the quiet ones, the ones most people shrug off as just aging. But behind them could be signs of heart problems, cancer, bone loss, or nerve damage, things that can be treated if caught early. You will meet people like Helen, who dismissed her aching leg until she was nearly unable to walk, and Tom, whose jaw pain turned out to be something far more serious than he ever imagined. By the end of this video, you will know exactly which aches deserve your attention, what they could mean, and most importantly, what you can do about them before they become something worse. Because your body always gives you clues, you just have to know how to listen. If you are over 65 or love someone who is, you will want to stay with us through every point. One of these signs could be the warning that saves a life. Please like, subscribe, and hit the bell icon so you never miss a video that could protect your health and help you live longer, stronger, and with more peace of mind. It started as a mild discomfort, a slight stiffness near the top of her left arm whenever she reached overhead or turned a certain way in bed. Marjorie, 69, brushed it off. Just arthritis, she told herself. Nothing to worry about. She took some over-the-counter pain medication and went on with her day. After all, at her age, a few aches and pains are just part of the deal, right? But over the weeks, the ache became more persistent, not sharp, just constant, always there, like a small pebble in her shoe. She noticed it more during walks, especially when going uphill. Then one afternoon, while shopping for groceries, she felt lightheaded. Her arm throbbed as she reached for a carton of milk. Within minutes, she collapsed. Paramedics rushed her to the hospital, where doctors confirmed the truth. Marjorie had been experiencing early signs of heart disease. Her shoulder pain was not muscular, it was referred cardiac pain, one of the most overlooked warning signs in older adults. When most people think of heart problems, they picture chest pain, a dramatic clutching at the chest, a sudden shortness of breath. But in reality, the heart does not always send its warnings where we expect. In older adults especially, women heart-related pain can show up in more subtle places, like the neck, jaw, back, or shoulders. Shoulder pain, particularly in the left arm, can be the body's quiet way of saying that the heart is under stress. This is called referred pain, and it happens because the nerves that carry signals from the heart also connect to other areas of the body. When the heart is not getting enough oxygen, it can confuse the brain into thinking the pain is coming from the shoulder or upper arm. This type of pain is often dull, heavy, or nagging. It may not feel severe, but it tends to persist. Some people notice it gets worse with activity like walking, climbing stairs, or doing chores and eases with rest. That pattern is important. It suggests that the heart is struggling to meet the body's demands. For many seniors, it is easy to ignore. I slept wrong, I lifted something, or it is just old age. These are common explanations. But when that ache lingers for weeks or seems to flare up when you exert yourself, it is time to take a closer look. Marjorie was lucky. Her doctors caught the issue in time. She underwent a procedure to open a blocked artery and was given medication to manage her blood pressure and cholesterol. Today, she is back to walking her dog, baking with her grandkids, and living life with a deeper appreciation for her body's signals. So what should you watch for? If you notice an ache in your shoulder, especially your left one, that lasts more than a couple of weeks, worsens when you are active or emotional, comes with shortness of breath, fatigue, or lightheadedness, do not ignore it. Make an appointment with your doctor. And be specific, mention your heart. Ask for an evaluation that includes a physical exam, EKG, and potentially a stress test or cardiac imaging. Most importantly, trust your intuition. If something feels different, unusual, or off, your body is trying to tell you something. You are not being dramatic, you are being wise. Pain is not always just pain. Sometimes it is a message, one that could save your life. Because the truth is, small aches can be the start of something big, And the sooner you listen, the more likely you are to catch it in time. Joe had always been a strong man. At 74, he still mowed his lawn, carried groceries without help, and prided himself on not needing a cane. So when his lower back started aching, he did what most people his age do, shrugged it off. Just getting older, he mumbled, probably the mattress. He started taking Tylenol in the mornings, using a heating pad at night, and telling himself it would pass. But weeks turned into months, and the pain never fully left. It was not sharp like a pulled muscle. It was something else deep, heavy, and hard to describe. Sometimes it pulsed. Sometimes it felt like it wrapped around from his back to his side. One day, while buttoning his shirt, Joe felt suddenly dizzy. His wife insisted he go to the doctor. What they discovered shocked them both. Joe had an abdominal aortic aneurysm, dangerous bulge in the main artery, running from his heart through his abdomen. If it had ruptured, he could have died in minutes. That deep, dull back pain had been the only warning sign his body gave him. Lower back pain is one of the most common complaints among people over 65. And most of the time, it really is something benign, pulled muscle, spinal arthritis, or years of wear and tear. But there is a specific type of back pain that seniors need to pay attention to. It is the kind that feels internal, like it is coming from deep within the body. It might not get worse when you bend or twist. It might not go away with rest. And in some cases, it might be your body warning you about something much more serious. Two major concerns that can cause deep lower back pain after age 65 are kidney problems, including infections or stones, abdominal aortic aneurysms, which are more common in men over 65 who smoke or have high blood pressure. In both cases, the pain often comes without warning and does not feel like the usual soreness from a bad night's sleep. You might also experience a pulsing sensation in your abdomen, changes in urination, or general fatigue. And while these signs can be easy to miss, ignoring them can have devastating consequences. For kidney-related pain, the discomfort often starts near the lower ribs and radiates downward. It might be accompanied by fever, chills, nausea, or cloudy urine. For aneurysms, the pain is often steady, deep, and located in the lower back or abdomen. It may feel like pressure or fullness, and it might get worse when standing or lifting. Take the story of Alice, a 76-year-old widow who loved gardening. She began noticing a heavy ache in her back every time she stood to water her plants. At first, she thought it was just old age. But when the pain started spreading to her side and she developed a fever, her daughter rushed her to the hospital. The diagnosis? A severe kidney infection that had nearly reached her bloodstream. Joe and Alice both learned the same lesson. Not all back pain is created equal. And sometimes, the pain you ignore could be the clue that saves your life. So what can you do? Listen to your body. If your back pain feels deeper than usual or comes with other symptoms like dizziness, fatigue, or stomach discomfort, see a doctor. Do not rely only on pain relievers. They might mask symptoms that need medical attention. Ask for imaging. An ultrasound or CT scan can reveal things that a physical exam might miss. Know your risk factors. If you have high blood pressure, smoke, or have a family history of aneurysms or kidney problems, be extra cautious. Remember, getting older does not mean you have to accept every ache as normal. Some pains are whisper-surly warnings your body gives you when something is not right. Do not silence those whispers. Listen to them. Follow them. They might be leading you to the care you need before it is too late. Tom was not the kind of man to complain. At 67, he had always taken pride in being strong, reliable, and calm under pressure. So when he began waking up with soreness along the side of his jaw, he figured it was probably from clenching his teeth at night. He told his dentist, who suggested a mouth guard. But even after trying it, the pain persisted. Then it began creeping into his neck. Some days it felt like a tight muscle, other times like a dull ache that would not let go. He noticed it most when he was walking fast or carrying something heavy. And more than once, the pain came with a wave of fatigue that left him needing to sit down and catch his breath. Still, he brushed it off. Until the morning he was walking his dog and felt that same jaw ache, only sharper, and this time, it radiated up into his ear and down his left arm. That was the moment he knew something was not right. he went straight to the emergency room. Tom was having a heart attack. Many people associate heart problems with chest pain, and that is often true. But in seniors, especially men over 60 and postmenopausal women, heart issues can show up in less expected ways. One of the most overlooked symptoms, pain in the jaw, neck, or throat. This is what doctors call referred pain. It means that the nerves carrying pain signals from your heart can confuse your brain into thinking the pain is coming from another area. In Tom's case, the discomfort in his jaw and neck was his body's early warning system, a quiet, red flag that his heart was in trouble. Why does this happen? As we age, our nerve pathways become more complicated. Pain signals from the heart can travel up into the lower jaw, the throat, the neck, even the shoulders and upper back. That is why cardiac pain is sometimes mistaken for dental issues, acid reflux, or tension headaches. Here is a real-life example. Linda, 72, began experiencing a tight, aching feeling in her neck whenever she walked upstairs. She thought it was posture-related. But after mentioning it to her doctor and undergoing a stress test, she was diagnosed with stable angina condition caused by narrowed arteries that reduce blood flow to the heart. Both Linda and Tom learned the same lesson. The heart does not always speak in clear words. Sometimes it whispers, and sometimes that whisper lands in your jaw or your neck. So how do you know when a jaw or neck ache is more than just tension or aging? Here are a few red flags to watch for. The ache is on the left side and occurs during physical exertion or emotional stress. It feels like pressure, tightness, or deep soreness, not a sharp, surface-level pain. It comes and goes, especially when you are active, and disappears when you rest. It is accompanied by other symptoms like shortness of breath, lightheadedness, sweating, nausea, or fatigue. If you are experiencing any of these signs, do not ignore them. Make an appointment with your doctor and be clear. Tell them you are concerned about your heart. Ask for a full cardiac evaluation and EKG, blood work, and possibly a stress test or echocardiogram. If the tests come back normal, wonderful. But if there is something brewing beneath the surface, catching it early could be the difference between recovery and crisis. Tom survived his heart attack and now tells everyone he meets, if your jaw hurts, do not see just your dentist, see your doctor too. It might sound dramatic, but it is true. Sometimes the pain in your jaw or neck is not in your muscle set, is in your arteries. And your body is doing everything it can to tell you before it is too late. Listen closely. Helen had always enjoyed her morning walks. At 72, it was her way of staying sharp and independent. She knew the faces of every neighbor on her block, waved at the mailman, and kept a steady pace with her little dachshund, Ruby, trotting beside her. But then something changed. At first, it was just a tightness in her calves. She figured she had not stretched enough. Then, halfway through her usual walk, her legs began to ache so badly she had to stop. After a minute of rest, the pain faded. But the next day, it came back, this time even sooner. The aching grew deeper, almost like a squeezing pressure. She tried to ignore it, slowing her pace, shortening her walks, thinking it would get better. It did not. Finally, her daughter insisted she see a doctor. The diagnosis? Peripheral artery disease PAD, a condition Helen had never even heard of, but one that affects nearly 1 in 5 people over age 65. PAD occurs when fatty deposits build up in the arteries of the legs, restricting blood flow. Just like clogged arteries in the heart can cause chest pain, blocked arteries in the legs cause a similar warning sign, pain during activity that stops with rest. It is your body's way of saying, I am not getting enough oxygen down here. This pain is called claudication. It often feels like cramping, heaviness, or fatigue in the calf muscles, thighs, or buttocks. And because it improves when you stop moving, many people ignore it. Just getting older, they say, I walked too much today. But this pain is not just a nuisance. It is a warning signal that points to higher risks of stroke, heart attack, and even limb loss if left untreated. Let us pause on that for a moment. PAD is not just about discomfort. It means your arteries are narrowing. And if they are narrowing in your legs, they are likely narrowing elsewhere too. PAD is often a sign of widespread vascular disease, a red flag for serious heart and brain complications. The scariest part? Many people with PAD do not know they have it. Some dismiss the symptoms as arthritis, poor shoes, or just aging. Others feel no pain at all, only weakness or numbness. That is why being aware is so important. Let us look at another story. Richard, 68, who loved fishing. He began feeling tingling in his feet and noticed his leg hair had stopped growing. His skin felt cool to the touch. These small signs, easily brushed off, were actually late-stage symptoms of PAD. By the time he saw a specialist, his circulation had worsened to the point where he needed a stent to restore blood flow. If he had waited longer, he could have faced something unthinkable: amputation. So, how do you know if what you are feeling is PAD? Here are some signs to pay close attention to. Pain, cramping, or heaviness in your calves or thighs while walking, especially if it goes away with rest. Numbness, tingling, or a feeling of coldness in the lower legs or feet. Slower growing toenails, shiny skin, or wounds on your legs that heal slowly. A noticeable decrease in the strength or presence of your leg pulse. If these symptoms sound familiar, do not wait. Ask your doctor for an ankle brachial index, ABI test. It is quick, painless, and measures the blood flow in your legs compared to your arms. This simple test can detect PAD before it causes serious damage. The good news? PAD can be managed. Quitting smoking, walking more, managing cholesterol and blood pressure, and in some cases, taking medication or undergoing a simple procedure can improve blood flow and reduce your risk. Helen now walks every morning again. Her pace is slower, but her confidence is back. And more importantly, so is her hope. Because sometimes, the pain in your legs is more than just muscle fatigue. It is your heart, your blood, your future trying to get your attention. And if you listen early, you can keep walking strong for years to come. Nina always carried herself with grace. At 76, she was still the kind of woman who sat up straight at the dinner table, always had her hair brushed, and never missed a Sunday service. But over the past year, something had changed. Her posture began to shift just a little at first. She felt sore in the middle of her back, between her shoulder blades, especially when standing for long periods. It's probably my posture, she told herself. Maybe I've been sitting too much. But the ache did not go away. In fact, it started to feel deeper, more persistent. Her back felt tired, almost heavy. She was not lifting anything unusual. She had not fallen. But the pain remained day after day, and when she started noticing that she felt shorter, even slighter in her clothes, her daughter convinced her to get checked. What Nina discovered was surprising and far more common than people realize. She had suffered a vertebral compression fracture due to osteoporosis, and she had not even known it. Middle back pain in seniors can be deceptive. Many older adults assume it is just another ache of aging, or perhaps a muscle strain. But a persistent, dull pain in the thoracic spine, the area between the shoulders and down to the lower ribs, can be a red flag. Sometimes it means that a bone in the spine has fractured without any obvious trauma. These are called silent fractures, and they often happen when bones have become so brittle from osteoporosis that they collapse under everyday pressure bending, twisting, or even sneezing. Unlike a sudden, sharp injury, these fractures can feel like a gradual ache or fatigue in the mid-back. Many people do not seek help because there was no fall, no major moment of injury. But left untreated, these fractures can lead to serious consequences: permanent posture changes, loss of height, chronic pain, and in some cases, difficulty breathing due to the compression of the chest cavity. Let us consider another example. Arthur, 81, a retired bus driver. He began noticing that his back hurt every time he stood at the sink. His upper back felt rounded, and he could no longer reach items on the top shelf. A bone scan revealed he had multiple vertebral fractures from advanced osteoporosis, even though he had never fallen once. His bones had simply weakened over time. But middle back pain can also signal other serious issues, especially in the pancreas, kidneys, or aorta. Persistent pain in the mid-back, especially if it radiates to the front or comes with digestive issues, can indicate pancreatic problems, including inflammation or cancer. If the pain pulses or feels like pressure, an abdominal aneurysm could be involved, much like in point 2. And if the discomfort worsens after eating, lying down, or lifting, it could be something entirely internal. So how can you tell if your middle back pain needs a closer look? Here are key warning signs. Persistent, dull, or deep aching in the middle back, lasting more than a few weeks. Pain that feels like fatigue or heaviness instead of sharp strain. A noticeable rounding of the upper spine or a loss of height. Difficulty taking deep breaths or changes in how your clothes fit across the shoulders. Accompanying symptoms like abdominal discomfort, unexplained weight loss, or digestive changes. If these sound familiar, do not delay. Ask your doctor for a bone density scan called a DEXA scan. It is the best way to check for osteoporosis before fractures occur. If pain persists or worsens, push for imaging like X-rays or MRIs to rule out silent fractures or internal causes. And remember, bones are living tissue. They respond to care. With the right treatment, calcium, vitamin D, medication, weight-bearing exercises, you can rebuild strength and reduce the risk of future injury. Nina, after her diagnosis, started physical therapy and began using light resistance bands. Her posture improved, and so did her pain. She now says, "I thought it was just aging, but it was my body asking for help." Do not ignore the ache in your middle back. It might be more than a sore muscle. It might be your foundation asking for protection. Pain is not always loud. Sometimes it is quite a whisper in your shoulder, a tug in your back, a cramp in your leg. But behind that whisper could be something that needs your attention. After 65, every signal matters. These 5 subtle aches are not here to scare you. They are here to remind you that your body is still speaking, still protecting you, still asking you to care. You have come so far. You deserve to feel strong, to live with awareness, and to act with wisdom. Because the earlier you listen, the longer and better you live. If this video opened your eyes or helped you feel more in tune with your body, please like, subscribe, and share it with someone you care about. Your support helps us continue creating videos that inform and inspire. And if you have experienced any of these subtle aches yourself, share your story in the comments. We would love to hear from you.